Hi, this is Pim from Smart Diabetics Academy. In today's video, we are going to talk about how many carbs per meal you should have if you are diabetic. In today's video, I will tell you how many grams of carbs you should have per meal if you're diabetic and why. So from what I see, most doctors, nutritionists, dietitians, and they just tell the patients to eat somewhere around maybe 45, maybe 60 grams of carbs per meal. Occasionally I see someone who had been told that they should have 30 grams per meal. And that's pretty much the lowest I've ever seen anyone being recommended. And unfortunately that's quite rare, because 30 grams, although not perfect, is pretty good. So why do we get so many different recommendations? 30, 60, 45? What's up with that? I don't really have a good answer for that, unfortunately. What I think it is that each hospital or medical facility, they have their own guidelines that needs to be followed. So they pick a number which is just slightly below the dietary guidelines, probably so that they can say that they are recommending a carb-restricted diet because they know that carbohydrates is a problem for diabetics. And then they have all diabetics count their calories, count their carbohydrates, so that it feels like they're doing something to control their diabetes. And when you know how many carbs, if you're following it strictly, you have 45 grams per meal, your blood sugar is doing this, they can say, hey, this is what's happening. And it's kind of predictable, even though it's probably quite hard for you to get control of your diabetes that way. So I would say most diabetics, unless newly diagnosed and you don't, the insulin resistance isn't that severe yet, you're going to struggle to have some good blood glucose control on 45 to 60 grams of carbs per meal. And they also often recommend that you have snacks, which are around 15 grams of carbs per snack. And that's just going to make it even worse. So when you add this up, 45 times 3 or 60 times 3 plus snacks, you're going to have quite a lot of carbs in a day. And that's not great for a diabetic, not at all. So obviously, if you are doing well on 45 grams per meal, congratulations, you can continue eating that way. I'm not going to argue with you. It's your body, it's your life. If you're doing well, all good. But what I want to say is that it's probably not the best way for you to eat if you have insulin resistance. It's going to be really hard for you to start reversing that when you keep feeding your body the carbs. And it can also cause other problems down the road. So if you can, try to limit your carbs a bit more for most of the time, for your own health's sake and for your chance of actually being able to reverse your diabetes. Okay, so my recommendation is that you don't eat any more than 10 grams of carbs per meal and no snacking. And if you need to snack, it should be a zero carb snack or very, very close to it anyway. So mainly fat, maybe a little bit of protein, you're gonna do okay. And I want you to keep your intake somewhat consistent so that you know exactly how your body reacts, or your blood sugar I should say, when you're eating a certain amount of carbohydrates. So if you never eat more than 10 grams of carbs per meal, whether that be 5 grams, 10 grams, the difference between 5 and 10 grams isn't huge. And the impact that 5 grams is going to have on your blood sugar is also going to be quite small. So what that means is that you will be able to keep your blood sugar pretty much consistent throughout the day. And consistent from meal to meal. If your blood sugar always goes up 15 points after you've eaten, when you've eaten 5 or 10 grams of sugar or carbohydrates, you know this. You're not going to have a situation where your blood sugar goes from 110 to 200. And then you're going to have this roller coaster that usually follows. And when we have poor blood glucose control, it can sometimes take a day, 2 days, for some people even a week before it starts stabilizing. So by doing that, you're kind of messing it up long term. But if you keep things consistent and low carb, and you know how many grams of carbs you're having at every meal, you're gonna see really, really good blood glucose control. Sometimes people cut out the carbs and the blood sugar is still high. This happens, and it still increases after a meal, even though there are barely any carbs in that meal. So what's kind of going on there? And today I want to say that it's usually a case of having changed the set point for your body. So it's sort of a delayed effect, if you like. And in effect, your blood glucose set point, which should be maybe around 90 or something like that when you fasted, maybe slightly less, down to 70s, 75, 80, depending on who you are, have you been eating before, but all of that is kind of fine. That's where it should be. Now maybe your blood glucose set point is 120, because you have been consistently high. Let's say you've been on 150 milligrams per deciliter. That has been your baseline for months, and your body has perceived that as high, but with a baseline that it thinks should be 120, for example. I'm just making figures up here. So your body has gotten used to this, and a drop from there down, even lower, below 150 maybe below 120, it's going to be perceived as a danger signal. So your body will make sure that it doesn't go too low. It will start releasing sugar from the liver, maybe producing more sugar just to keep it up where it wants it to be. So this usually comes right on its own with a little bit of patience and consistency. So what you really need to look at is whether your numbers are stable. So if they are not jumping all over the place, but the baseline is a bit elevated, you don't need to worry. Not for now. Long term, it's not good if your baseline is elevated, but for now, when you just changed your diet, give it a little bit of time to come right before you start panicking and saying that it doesn't work, because it probably will work. So just keep eating a maximum of 10 grams of carbs per meal, no snacking, and if you do snack, no carbohydrates in those snacks, and don't forget to add fat to replace those carbohydrates that I have cut out. Thank you so much for watching. I hope you have enjoyed this video, and if you do, please give the video a thumbs up, subscribe to the channel, press that little bell icon down there so that you will be notified whenever I post a new video, and I will see you again in the next video.